My name is Alexis Jones, and I am a health, education, and behavior major at the University of Florida. And I also work in the sector of pharmacy that the Center for Medicare and Medicaid Services calls Medication Therapy Management, where I work with a team of pharmacy professionals educating patients on the importance of adherence. Often when speaking to patients, I hear complaints about the rising cost of healthcare and prescriptions. Recently, I spoke to a patient that has stage 3 liver disease and needs a medication known as Xifaxan that drugs.com lists as an antibiotic. But it cost this patient nearly $2,000 US for her prescription on a fixed income. This is nearly impossible to afford. But like this patient, like millions of others, medications can be the difference between life and death when the cost of healthcare is a concern. So today, I am here to urge you as Americans to not support repealing the Affordable Care Act unless the federal government is able to enact a more uniform and universal healthcare system. First, I will begin by discussing the current issues with our healthcare system and talk a little bit more about the Affordable Care Act. Then I will discuss solutions, followed by the benefits of uniform healthcare and ways that we can act. The Commonwealth Fund gave a report based on data provided by the Organization for Economic Cooperation and Development, which was basically a cross-national comparison of 13 developed nations. In the report, it stated that the United States spends by far more than any other nation on healthcare. And despite spending more on healthcare, Americans had poorer health outcomes, greater prevalence of chronic conditions, and also shorter life expectancy. This is a graph provided by the Commonwealth Fund that shows the cost-related access barriers to health. Here are the 13 developed nations. As you can see, the United States leads in cost-related access barriers. Cost-related access barriers are basically when a patient has a health problem but does not visit the doctor, skip their medical tests and treatment, or follow recommendations or did not follow recommendations by their doctor, fill their prescriptions, or skip doses. So as you can see, more patients cannot receive health care because they cannot afford it in the United States. Our former President Obama made an effort with health care reform with the Affordable Care Act. Healthcare.gov states that the Affordable Care Act seeks to reduce the cost in healthcare in general and expand the Medicaid program. Conversely, there is still a lack of efficiency within our healthcare system. I read an article in the Harvard Public Health Review titled Universal Healthcare, the Affordable Dream. In that article, it states that in the absence of systematic healthcare for all, often chronic diseases can develop, which makes them more expensive to treat. So there is obviously two major issues with our healthcare system. The first being rising costs, and the second being limited access to care. So now that I've discussed the current issues with our healthcare system, I will begin by discussing the solutions. The state of Vermont's official state website provides the blueprint for health. That is a state-led, nationally recognized initiative to improve health care for Vermont residents. And Vermont state legislation, Act number 48, is an act relating to universal and unified health system with the intent to provide a comprehensive, affordable, high-quality, and publicly financed health coverage for all Vermont residents, regardless of income, assets, health status, or availability of other coverage. This innovative effort to healthcare reform is a collective effort made by the state of Vermont, the residents of Vermont, an independent board with input from medical professionals, businesses, and the public, while maximizing receipt of federal funding, including those accessible pursuant to the Affordable Care Act of 2010. The residents of Vermont have equal access to affordable, quality health care as a public good. Now that I have shared with you the current issues and our solutions, now I will discuss the benefits of universal health care. The World Health Organization is committed to the goal of universal health care. That is when everyone has access to health services without the risk of financial ruin or impoverishment. Julie Pease, a medical doctor in Maine, once stated, "No other nation uses our unique private insurance system, which penalizes the sick by charging them more, by reducing their benefits, or denying care altogether." With universal health care, Americans can appreciate cheaper medical costs, better preventative measures for chronic conditions, and reduce economic poverty. Imagine being able to go to the doctor regularly, receive treatment, and fill prescriptions without having to be concerned whether an enormous bill will follow. Imagine being able to retire without having to be concerned whether or not health care will be affordable or if you'll have to return to work just to receive health coverage. Imagine living longer, living healthier, being happier. This is what universal health care would mean to our society. In conclusion, if we repeal the Affordable Care Act without a better solution, such as universal health care, the cost of medical expenses will skyrocket. Millions of Americans will lose their health coverage. Data proves that developed nations with universal health care have better health outcomes. As the U.S. spends more on health care, many hardworking Americans still don't have adequate health care. No patient should have to pay $2,000 for an antibiotic. This is an injustice. My goal is to bring awareness that health care is a human necessity and should be available for all Americans. So, together, we can work together to make a difference. Vermont has provided us with a blueprint for health. So, together, let's all make the difference. If you would like more information on Vermont's Blueprint for Health, I have some cutouts of links to the websites that you can review more information. And now I would like to open the floor for any questions and answers. Yes, sir.
You said that's in Vermont. Is that the same kind of understanding that we should have here in Florida? You did say they were comparable, so this is the same kind of Rule 48 that maybe other states might be wanting to?
Yes, so the Act number 48 is a legislation that other states can adopt. To my knowledge, Vermont is the only state that has universal health care. But my goal is to encourage everyone to support universal health care for all Americans equally.
On that level?
Yes. Any other questions? Thank you all for your time.
Well,